we get together every week, week after week, to close our NCLEX journey, our weekly NCLEX journey. Hey, did you guys know? Let me say this. This is the best NCLEX review on the planet. And the reason why is not because of me, but because of you. Hello, Amina. How are you? We do this thing. It's a little program that we have every week. You guys know what it is. Let's Talk NCLEX. And this is our opportunity to bring our questions and our concerns and highlight the things that we have been posting here at Remar Review all week long. If this is your first time joining us, bienvenido. Welcome here. My name is Regina Callion. I have the pleasure of working at the best NCLEX review in the world. I have the pleasure of being the best NCLEX instructor in the world. So it's just the best. It's just the best here. And I thank you guys for taking just a few minutes out of your busy schedules to review with me. Hey, it's your first time. Welcome. You're really going to like it. The nursing community that we have here, not only are they just amazing people, but they know so much. Literally, I'm learning from you guys every day. I love when you reach out to me, when you email me. I have to start by saying this. Thank you, everybody who came to the Remar Review Scary Topics that we had this Monday. It was such a fun event for me, and all the work that we put into the program, put into the review, it all paid off. Seriously. We had so many Remar nurses come, and we talked about, we did a Facebook Live for you guys that didn't make it. We did a Facebook Live Monday night at 8 p.m. Eastern time, and we had thousands of nurses, oh my goodness, on. You guys actually crashed my website. But it's all good. And we talked about difficult pharmacology, some never heard of diseases. We went over the fetal heart monitor. It was just an amazing time. And there were literally thousands of Remar nurses at that time. So I'm sure we will do it again. So thank you. I wanted to say thank you for everybody who could make it to that event. I had a lot of fun. Hey, if you missed the event and you are thinking about studying with Remar Review, you have to check out the website. It's remarreview.com for our new visitors. For our old visitors, we have a lot of cool things on there. You can definitely get your NCLEX review, more inspiration, because we put up the testimonials on there. And just connect with us. Just connect with us there. remarreview.com. It's a simple website. We get a lot of traffic because there's some good things on there. I have so many testimonials. Seriously, you guys know how I like to shout out. You notice how I like to shout out. Not only you, thank you. Not only do I like to shout out new nurses who are studying, but I also really love to shout out everybody that's passing every day in the Remar nurse community. And I had so many Facebook posts that I couldn't even isolate them all. So I'm going to just have to spend a day where I just shout out all the nurses that are passing, because I might have to just devote an entire show just to the testimonials that we get, because there are just so many of you guys that are taking your exam and coming back and telling us, I made it, I got my license. So you guys remember, when you give your testimonial, we see your video, it inspires so many people. You pass NCLEX, you tell your story, and we're able to give you the Remar nurse shirt. It is super cool. And I love to see my Remar nurses wearing that shirt. It's somebody's birthday. Whose birthday is it? Happy birthday to one of our Remar nurses today. I missed whose it was, but thank you for coming on here and spending your birthday with me. I appreciate it. We're doing Let's Talk NCLEX. Hey, everybody. So I post NCLEX questions up weekly. Not only do I do them on Facebook, but we also do them on Instagram. So are you guys ready? Are you ready for our NCLEX question for the week? It was on our Instagram page, And I bet every Remar nurse here will get it today. So here's the question. An overdose of which of the following medications will cause this pathologic condition? Note the condition. All right. So we're looking for the medication that will cause it. What say if you guys? Is it number 1, digoxin? Number 2, acetaminophen? Number 3, metoclopramide? Number 4, morphine? Which one will cause this condition? What is this condition? What is this condition? And then tell me the answer. It's a really simple one. I should see the answers rolling in, rolling. They rolling in. I got 2, 4. Okay. So I thought they would all really be the same, but I'm getting a variety. So if you guys notice this eye, if you notice this eye, it has a little tinge of what? Yeah, it has a little tinge of jaundice to it. So what medication is going to cause jaundice? And think about it as I'm reading the answers. What is jaundice? What is affected when you have jaundice? What is affected when you have jaundice? Yeah, you guys got it. Good job. Right. So you guys know, good. I'm seeing it now. Yep. Bingo. All right. So the correct answer is going to be that acetaminophen. Jaundice is actually a term that is used to describe the yellow tinge that the skins and the whites of the eyes will have. So make sure that you guys are able to definitely distinguish this. It's a pretty common clinical condition, but absolutely large doses of acetaminophen, Tylenol can cause hepatic injury to your patient. So it's very important. It's very important when you're studying for NCLEX that you note that not only is Tylenol, acetaminophen, used to reduce fever, it's an antipyretic, but it is also very challenging for the liver to metabolize large amounts of acetaminophen. So the liver is responsible for metabolizing pretty much all the medications that we choose to ingest in our patients. So somebody with issues in their liver will have a very hard time getting the full benefits of a medication. So sometimes, we can give a patient a medication and we could say, that medication is not working like it's supposed to. Maybe they need more. So we give them more medication and the doctor prescribes more medication and the medication is not behaving the way you expect it to. Like perhaps the patient, perhaps their blood pressure is not responding to the medication. So what do? We give them more blood pressure medicine and more blood pressure medicine. And sometimes if we just stop and do a liver function test, we will see that, the liver is not working to its optimal level. So these medications are not going to clear or behave the way we want to. So it's very important that we understand how the organs function when it comes to polypharmacy and the very basics like that, right? So that's what NCLEX is about, knowing the foundations of your nursing practice, which wholly surrounds around the human body. So it is a good basic question to review and to get you to think, do I know about jaundice? Do I know about the medications that were listed? Make sure that you're writing down all of those things, okay? All right, so that was our Instagram question of the day. If you follow us on NCLEX on Instagram, you have seen that question and you already know the answer, which is pretty cool. So follow us there, and I always post like really good pictures or really gory, gross pictures, depending on what you are interested in. Okay. All right. So here was our question on Facebook. Actually, here was our page on Facebook. It says, a nurse is assisting a client instill a nasogastric tube. Which of the following interventions will be most effective when the client complains of choking on the tube? Okay. So we have the scenario here. The nurse is putting down an NG tube, and the patient says, I can't take it. I'm choking. I can't handle this, which happens so often. So we need to figure out what is the best intervention to help this patient tolerate the tube going down the throat. So let's look at the choices now. We have number one, placing the client in a head to the side position to facilitate the position of the tube. 2, ordering a guided X-ray assist to facilitate the position of the tube. 3, massaging the throat while placing the tube. Or 4, offering the client ice chips while the nurse advances the tube. Okay, so I see the answers coming in, all types of answers. What is going to be the best? You got to pick from the choices that are there. So what say, good, you just did perfect. I'm glad. When you guys see things, I want you to say, Regina is asking me to study this because it is important for my studying. So I thank you guys for participating. I'm seeing all the answers come in. Most of them look like 4, but I do have a couple number 1s, placing that patient's head to the side. Okay, got some 2s coming in. I did see 2s on the Facebook page a lot, thinking that the guided X-ray assist is going to be best. Actually, the correct answer, I see you putting them in, just some last minute ones. Okay. Ricole said, why the ice chips though? That's interesting. So the correct answer is, where is the correct answer? Hold on. The correct answer is here, I promise. And I'm just going to tell you guys what it is because somebody's been messing around with my slides. The correct answer actually is number 4. The correct answer is number 4, and that is going to be offering the client ice chips while the nurse advances the tube. And I know you guys are used to seeing water, right? I know you guys are used to seeing water when you talk about helping the patient to swallow, but actually ice chips are acceptable as well. And you guys might not know that. So if you saw it on NCLEX, you might have thought, ice chips, I don't know, those sound really unnecessary. Like Raquel's like, why ice chips, right? But it helps to have the patient to have a nice hard swallow, right? Nice hard swallow, and the tube will go down. Most people, they're okay. Like, it's a mental blockage because usually you don't have things going against the gag reflex like you need to be able to tolerate with the NG tube. It's a mental blockage, just like you just don't do this. So you have to get your patient in the mindset to overcome that. It's kind of like the same thing when you're teaching your patient how to put in contacts, right? Normally people don't ever touch their eyeball. So it's very, very difficult for them to do that. But once you get over the fact that you have to do it and you do it, it's easy. It's like second nature, right? It's like second nature. So if you guys encounter a question about putting down an NG tube, you now know that not only water is acceptable, but ice chips are acceptable too. So thank you guys very much, because I get a lot of great questions just right from the emails that you send me. So I love to share them. So I like to do this section. That was our NCLEX question for the week, but I have some other things I would like to review with you guys. I got this question this week for Ask Remar. I'm going to show it again. It says, people say, hey, Regina, I have problems answering questions with the term contraindicated. I know it means to stop. Oxford definition, please, if you can help. And I love this question because I'm like, contraindicated. This is a very common question that I get actually from the Remar nurse community. So this is what I have to say about it. Essentially, when you see, this is a very common concern, if you see adverse effects, contraindications, side effects, these all generally mean the same thing, which is something's going to be wrong with your patient. Identify it based on a certain amount of clinical cues. Now, the great thing about studying the NCLEX test plan, which I always tell you guys to look up it. Listen, the things I tell you come from that test plan. You will only get a certain group of topics about contraindications, side effects, adverse effects, okay? And it comes right from the test plan. So I wanted to show you guys this. Here it is. So if you look at that NCLEX RN test plan, it tells you that these kind of questions are coming from the pharmacological and parental therapies section. All right. So that means these questions are all going to be related to the administration of medication or IV therapy RNs. Okay. So you see here that adverse effect, contraindications, side effects, interactions, they're all grouped together. They're all grouped together. And these questions are always going to be surrounding your medications. I tell you guys things for a reason. Okay. So the Remar nurse said, hey, I need some help. I need some help with these kind of questions. So what I can do is just show you guys what I mean when I say that they will be presented in a certain way. So here we go. Which of the following is a contraindicated action of a client taking alendronate sodium? Oh my goodness. Do you have your quick facts book? Because if you have your quick facts book and you are studying the pharmacology section, then you will be able to know about this old medication. Is there a Remar nurse in the house? Is there a Remar nurse in the house that wants to put up what this medication is for? All right, because we're talking about the contraindicated actions of this medication. So is it going to be number one, taking the medication before exercise? Two, drinking 10 ounces of water with the medication. Is that contraindicated? Three, taking the medication after getting out of bed. Or four, lying flat for 1 hour after taking this medication. What shall the nurse be teaching the client not to do? All right, so what is the action that you do not want to do when you are taking this medication? All right, lots and lots of answers coming in. You guys must know this medication, huh? All right, everybody watching, this is very basic stuff, fundamentals right here with Remar Review Fundamentals. This is Fundamental Friday. We are talking about what is the contraindicated action here. All right, so the correct answer for you guys, is going to be, you do not want to be lying down flat for 1 hour after taking this medication. Actually, you need to be sitting up. You need to be sitting up for 30 minutes up to an hour when you take this medication, okay? When you take this medication. How'd you do? Did you guys know this? This is a basic pharmacology question. You really, with a question like this, let me go back to it. Here it is. With a question like this, you basically have to know the medication. There is really not going to be a strategy for you guys to figure it out if you cannot identify what the medication is and actually go into the teachings. So this is why we do focus on the content here at Remar Review. This is a perfect example of where a strategy, like trying to compare the answers, is not going to work. And I see the question. All right, so this is the kind of instructor I am. if you guys are going through a question like this one and you can't connect why the correct answer is the correct answer, like you have no idea why you cannot lie down flat for 1 hour after taking this medication, then my expectation is for you to what? To look up why after you take alendronate, sodium, why you cannot lie down flat. Because if you don't know it now, just me telling you is not going to it's not going to be as permanent in your mind as if you actually take the steps to look up the information yourself. That is how you study. In your nursing career, it is going to be very difficult if you want to wait around for another nurse to come and help you. It's probably not going to happen. Just keeping it real. A nurse that is very busy is not going to have the time to sit down and explain to you why a patient is taking a medication. All right. So you have to, in the very initial stages of the studying process and in your nursing career, be willing to look things up. Okay. Be willing to look things up. All right. So here we go. Let's keep going. Let's keep going. All right. So shout out to Quick Facts. Shout out to Helen that says all my exams were literally from Quick Facts. That's because Quick Facts got that core content. Every nursing student should have a Quick Facts book for sure. All right, here we go. Let's do another contraindicated question here. A client is on a low bacteria diet due to neutropenic precautions. Which of the following seasonings are contraindicated? So we got a neutropenic precaution. Do we know what these are? A client is on a low bacteria diet due to neutropenic precautions. Which of the following seasonings are contraindicated? We got ketchup, number one. Do we not want our patients eating mayonnaise? Do we not want our patient using salt? Or is it ground pepper? Got answers coming in. Thank you guys for putting up your answers. Put up your answer and share this video. Got all kinds of questions coming, all kinds of answers. Patients on neutropenic precautions. What is that about? Oh my goodness. What is that about? And why don't we want them to have certain types of seasonings? What is it? I see a lot of people picking number two. What is it about the mayonnaise? Some people just don't trust mayonnaise. Some people, they just don't trust the way it looks. They say it's shiny. But literally there is a reason why. There is a reason why. Oh, I know the strategies are not going to work here. All right. So this is strategies won't work Friday again. This is fundamentals and strategies won't work Friday with this information. Let's talk about it. Made up of eggs. You worried about the eggs, the mayonnaise? All right. So the correct answer, let's look at the question again. We have ketchup, mayonnaise, salt, ground pepper. The correct answer is we want them to stay away from the ground pepper because it is an unprocessed food. So anything that is unprocessed means that it is a potential breeding ground for bacteria. And if somebody is on neutropenic precautions, we need to protect them. So I think I did some notes on neutropenic precautions for you guys here. Here they go. All right. Neutropenic precautions is also called, come on in and learn with us here. It's also called protective isolation. The reason why it's protective isolation is because we're actually protecting our patients from us, from the healthcare professionals, because we are really covered in gross things, right? From just being around other people. But essentially, you're going to follow all of your standard precautions. So everything you do with standard precautions, but you have to limit your patient to sources of bacteria. So normally when we're studying, it's like, okay, limit foods with bacteria. That is anything that is unpasteurized, unprocessed, raw foods, raw meat, a lot of your seafoods, things like that, we have to keep our patients away from. And you guys also know about like no fresh flowers, no standing water. Yes, when you are coming in and out of the room, you need to wash your hands, right? You need to wash your hands. This is all part of the neutropenic precautions, and it is used to protect our patients, right? Yeah, you guys are doing really great. These patients also typically have a private room, So that's really cool too, something for you to know. Hey, Regina, so you just know my first question on NCLEX was one from the Motivational Monday video. Okay, cool, perfect. Keep watching here. Yes, in mayonnaise is actually a processed food. So those eggs are good to go. They're not raw eggs. So what do I mean by standing water? That's a really great question. Sometimes you have standing water, like water basically that's just sitting. So if you have flowers and you pour water into them and they're just like, that's just standing water. Some patients like to have water at the bedside and it's just there for days and days and days. You know, that's standing water. It's just water that's there. And it can be a source of growth for bacteria and germs for that patient. So this is typically what you see for neutropenic precautions. Neutropenic precautions and reverse isolation are very, 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 very similar. Yep, very similar. And so the pepper actually does not go through it doesn't go through a heating process. It doesn't go through a cooking process. It's literally just the fresh pepper. So it could have bacteria in it. All right. So that's the concern for your patient. Let me push you guys a little bit further, because sometimes we recognize information. But we don't really process it, right? So people can say, yes, neutropenic precautions. I get it. I know what it means. I'm trying to protect my patient, but NCLEX likes to take it to another step further and actually put you in a clinical scenario. So let me ask my REMAR nurses this. Are you guys ready? If my client is under neutropenic precautions, should I wear sterile gloves or non-sterile hospital gloves? Which one? What say if you, REMAR nurse? What do you guys think for neutropenic precautions? What's going to be the best for my patient? What's going to make the most sense for the patient? This is what NCLEX does, right? It challenges you to take it one more step. So what do you do? If my patient is in reverse isolation, should I wear sterile gloves or non-sterile gloves? And think about, we're trying to protect them. We're trying to protect them from germs, bacteria, things like that. I got so many answers. You guys are on it today. With the answers. They're just firing in. Really cool. All right. Yeah, no. If somebody's like, I really don't know. Okay. Sterile, non-sterile. Okay. All right. So here it is. Here's the answer. Here it is. Bam. Okay. Always wear clean non-sterile gloves and gown when entering room. Okay. And don't forget to take those things off before exiting the room. You want those gloves to be non-sterile. There is no reason why you need to have on sterile gloves to touch clean environments. It's a non-sterile environment. So it will be okay for you to just put on your regular hospital gloves after washing your hands to protect this patient. Does that make sense to everybody? Non-sterile gloves? That makes sense? Sterile gloves are so expensive too. Can you imagine opening up sterile gloves every time and trying to be sterile in a patient's room when you got to go in there and change the sheets and turn on the TV? You know, so think about it in that way. Does this practically make sense? What the care that I'm providing? All right. So I love to hear from you guys. Let's Talk NCLEX is so fun to me because literally it's conversations that I've been having with you guys all week long anyways. And so send those emails to me. My email address is support. Doesn't that make sense? support@remarreview.com. I had an amazing week. Because of the live review that we did, but also this is a great start to my weekend. And I see you guys are asking me, what about this? What about the next 7 days of NCLEX? The next 7 days of NCLEX will be the next 7 days of NCLEX. I don't know. I haven't thought about it. It really takes so much work to put in. That 7 days of NCLEX is a monster. It's a monster. I know you guys love it, but I literally have to. It's coming. It's coming. Don't worry. I got you guys. I know. And that's how we do these weekly. That is why we do the weekly get-togethers, because it helps to keep us not only together, but also motivated. And we have a great time when we do it too. So I know you guys know that on Monday, I will be back on for Motivational Monday. I can't wait to do this Motivational Monday. So make sure you don't miss it and that you're here for it. Here we my review. We love to hear from you guys. We love to interact with you. And I like to see the conversations that you guys have even when I'm not around, because there's some pretty cool things that are going on as well. Our class motto, POW, we can, we will, we must pass NCLEX. That's what we say around this camp right here. And go ahead and send me. I know you guys want to see certain type of videos. Go ahead and send in the requests. I write them all down, and even though they're the same, I get the same for prioritization, EKG, those four. I'm taking them, and I'll do them again. Until everybody has seen them. All right. Again, thank you guys so much. This was Let's Talk Friday. It has been presented. I hope to see you on Monday. Have a great weekend. We can, we will, we must pass NCLEX. See you later. Bye-bye.